Anandam Paramashugadam Kevalam Jnanamurtim Valvadidam Gagana Sadusham Tattvamasyadilaksham Egam Nityam Vimalamachalam Sarvadi Sakshi Bhudam Bhavadidam Trigunarahitam Satgurum Tam Namami.
Hello, welcome friends. As part of the Hindu Doctors Without Borders, this is the first panel discussion amongst various doctors to address health issues through allopathic and all ancient traditional medicine. We are honored here to have 5 practitioners. First is Dr. Nivita Balu, a naturopathy and yoga doctor, runs Padma Surya Naturopathy and Yoga Hospital and Divya Bharati Naturopathy and Yoga Hospital in Coimbatore, India. Next, we have Anusha Tyagarajan from Houston, Texas, classically trained certified homeopathic practitioner, certified Ayurvedic counselor, certified health coach, certified yoga instructor, and she practices in Houston, Texas. Then we have Dr. Shanti, MD. She is an OBGYN doctor, practicing in Bangalore, India. Then we have Dr. Pooja, MD. She also has a PhD in Panchakarma, specializing in the field of Ayurveda. Currently, she is working as associate professor in the Department of Panchakarma at Shushtra Ayurveda Medical College and Hospital in Bangalore, India. Finally, we have Prema Kodanraman, MD. She is a board-certified OBGYN, fellowship trained in pelvic surgery and urogynecology. She runs a private practice in Los Angeles, California. And my name is Kumar Swaminathan. I'm working in the healthcare industry for the past more than 25 years on the business aspect of the medical care. The topic today that the doctors chose is PCOS, Polycystic Ovarian Syndrome. It's an issue that's prevalent worldwide, affecting women of all ages. More than 100 million women suffer with this. It's an interesting topic. I'm sure there is a lot to discuss. So I'll first turn it over to Dr. Shanti. Shanti?
Namaste. Am I audible?
Yes.
It's one of the common presentations, common problem that we come across. People come to us, all age group, young girls, teenagers, young women, married, yet to get married, and married women who are eager to conceive, having infertility. Varied, it's a huge spectrum of presentation. What we see is just tip of the iceberg, as we say. A part of the problem is only seen. In young girls, they present to us with amenorrhea, means absence of menstrual cycles for long period, like 5 months, 6 months, sometimes up to 1 year, scanty period, sometimes heavy flow, and obesity with the acne and hair on the face, the male type of hair distribution on the face. These are some of the clinical features with which they come to us. We have lean PCOS and obese PCOS. Obesity is on the rise now in young girls due to the lifestyle. And also in young women, they come to us with scanty flow called as oligomenorrhea, sometimes with menorrhagia, heavy menstrual cycles. And infertility is one of the major features with which they come to us. And also in women who have already conceived and delivered with menstrual disturbances and obesity and hirsutism. These are some of the common features with which they present to us. Depending on their problem, what they are looking for solution, we are trying to help them. The integrated approach is more helpful and it is holistic. This is what I would like to share regarding like the clinical presentation, the varied clinical presentations with which they present to us, including the metabolic disturbances like insulin resistance is one of the major factors, and the fat distribution, all that we will discuss in as the session goes on.
So I would like to turn it over to Dr. Nivita next.
Yes, it's a namaste. It's very happy to start. It's a good idea to have an integrated approach. Actually, as Madam says, there's so many symptoms, but every symptom have its own background. Actually, we see this PCOS is a lifestyle disorder. Actually, when we see the human body it is a component of a nature. How the macrocosm, that is the universe, is made up of 5 elements, our human body is also made up of 5 elements. So if both is in rhythm, then the body will be in its own nature's gift, that is a healthy way. But when there is a rhythm, there is any disturbance in the rhythm. Example, if you say take a moon, it has a 15 days of, it's a growing moon and it is a depleting, and it comes as a new moon and full moon. So the same way, our female body, the cycle also with the rhythm of moon. 15 days, we have a follicular stage, it is a proliferation happens. And after 15 days, when the egg got conceived, then automatically again it is growing. But when there is a the irregularity happens, that is because of the lifestyle, that is if they are not sleeping in a right time, or if they are not following a rhythm of the lifestyle. So what happens? The rhythm changes. What happened? Instead of follicular stage, actually in follicular stage, in during our there is a embryogenesis. At the time of the genesis, there is more than 4 million egg bags will be formed in the ovaries. When the baby get delivered, it reduced to 4 lakhs. When the girl it attained the first puberty, it reduced to 1 lakh. When it becomes 0, they end with the menopause. So when there is any changes in the regular pattern of nutrients, or the cyclic changes, that is a poor nourishment or poor lifestyle, irregular way of eating habits, irregular way of sleeping habits, this rhythm is changed. So what happened? Instead of 15th day ovulation, it is not ovulated. So what will happen? Instead of ovulation, for ovulation, what will happen is the first day during the follicular stage, that is the periods, the first day of the period, there is a in number of follicles will form, the primary oocytes. So what will happen? This will, at the 7th day, when the period stops, that time it will reduce to the half. And 15th day, it will reduce to 1 and it will form the matured egg. On 15th day, it will release and we call it as a ovulation. That is on the 15th day. And the remaining, the corpus luteum, it will produce the progesterone, which will form the endometrium thickness. So when the baby is formed, then there is a zygote is formed, then it will start growing and the pregnancy ends. But when there is not happening, the zygote is not formed, what will happen? On 15th day, after ovulation, corpus luteum start producing the progesterone, and 30th day, the progesterone, there's a corpus luteum will go for death. So the progesterone fall down. Because of the excessive progesterone, estrogen, the endometrium will bleed, that will shed off. So that is called periods. But when this rhythm is disturbed, when the lifestyle is disturbed, this rhythm is disturbing. So instead of maturing into one egg, the follicle will remain as such. Then there is a water filled in the follicles, it called cyst. So there is a number of cysts will be more. So there is a polycyst which is present in the ovary. So we call it as a polycystic ovarian syndromes. Because of this unnatural cyst, it will produce male hormone. So we are getting hirsutism, that is the abnormal hair growth in the chin or in the chest or in the pubic areas. More it will be abnormal. And also there is increased sugar level will be increased. The obesity will cause. So all the male nature it will comes, and there is a main thing is anovulatory cycle. There may not be any ovum released. So we call it the anovulatory cycle. This is the major causative factor for infertility. So here the major cause for this is, one thing is there is a nutritional deficiency. Nowadays, because of the wrong lifestyle, because of more maida product, refined product, and less of exposure to nature, what will happen is inside the body is not converting from one cell to the another cell. We call in naturopathy and Ayurveda, we call it a sabda dhatu. Actually, what we eat, it will become, first one is the juice, then rakta, then mamisam, that is a muscle, then it will mages, that is a fat, then it will go to bone, then bone marrow, then chuklam or the egg, then the ojas, prana, tejas, all this will come. But the 7 stages, to make it one from the another, we need the perfect, the gut microbes. Gut microbe is the one which gives more minerals. That mineral which helps to turn one dhatu to another dhatu. Blood dhatu to muscle dhatu to fat dhatu to bone dhatu. So there will be a continuous transformation. So if the gut bacteria is not there, we can manage with exposure to nature. But unfortunately, nowadays we are not exposed to nature also. There is no sunlight, there is no soil exposure, there is a less of air exposure, the fresh air exposure. There is a lot of acidic water intake in the form of more caloric water or RO water or more acidic waters, bottled waters, which is not exposed to 5 elements. What happens? We become more acidic. So because of less nutrient and not exposed to nature, this transformation of one dhatu to another dhatu is not happening. That is the major reason the polycystic is nowadays coming up. I can say it is an endocrine system. It is coming from the abnormal, that is a production of the hormones. The major causative factor is, one is modern lifestyle and also more stress. Actually, these hormones are coming from the stress. Actually, when we see any fearful environment, if you see any snake or any fire or any accident, what will happen? Our body is producing much more release of there is a hormone, stress hormones. Like that, our ovary also is an endocrine gland. It will produce more hormones. When the rhythm is disturbed, the hormone system also is disturbed. So there is a 3 causative factor I can say. One is stress. The another one is more usage of gadgets and increasing body heat, and there is a decreasing in the microbe in the gut, that is in large intestine, gut bacteria is reducing. It leads to more vitamin B complex deficiency, vitamin D deficiency, and third one is less nutrients. So in this, if we address, there is a very good change. Nowadays, the people with the combination of this work we are doing with the natural things, the people are more, actually they're getting very good, comfortable periods. And so many people are getting, that is a pregnancy, and they are giving a natural births. So as a discussion goes on, we will talk a little bit in an expanded way also. I'll hand over to the other people. Thank you.
So now we invite Dr. Anusha Tyagarajan to share her views on this polycystic ovarian syndrome.
So thank you for giving me this opportunity to share about this topic of polycystic ovarian syndrome. It's widely prevalent around the world, and as we age and as we go on, this problem is increasing in number. So being a homeopathic and a certified health coach and a new holistic nutritionist, I would like to share a holistic perspective of this problem. So as Dr. Shanti and Dr. Nivedita was sharing, definitely yes, there is imbalance in the menstruation, suppressed menstruation or profuse menstruation or irregular menstruation or having developing cysts in that, and all kinds of pathological conditions they were mentioning. Yes, these are the common condition that we see externally. But if you look in further, as a person, as an individual, we will also see them. There will be fluctuation in their moods. in their physical and their mental capabilities. So physical, mental, and in the emotional level makes a person complete. So a balanced state is being balanced in every level of the individual. So when there is an imbalance in the moods, that adds up to the problem. So when there is more irritability, for example, fluctuation, so there may be overindulgence or improper eating and improper digestion sets in. So not only it affects the mental level, emotional level, and we are also affecting the digestion of the body. So there may be overindulgence, underindulgence, non-indulgence, improper. So the food, psychological eating comes in. So, and also the fluctuation in their balance in their mental level to act according at the proper time, to eat properly at the right time, to eat the right foods at the right time. Whenever we are under stress, we try to eat foods which are not good or healthy for our body's nourishment. So I would like to add on this point which Dr. Nivedita was pointing out about this waxing and the weaning stage of the moon. So the women play a huge role similar to this moon cycle. So when the bleeding completes, when the menses completes, so immediately the body becomes weak. So at that time, you need to take care by nourishing the body and vitalizing the body for preparing for the next ovulation. And strengthening the immune system is very much needed during this period. So the timely ovulation happens. And after the ovulation happens, the body, we also become slightly closed or decrease in energy starts happening. And we also observe before the periods, we tend to sleep more, or there is an increase in the fluctuation in the emotions, or we become more sensitive to surroundings and things like that. So as women, we are responsible for this body. So we need to observe ourselves where we are in the moon cycle or in the periods or in our lifestyle or in the overall energy level. Homeopathy addresses the energy of the person. It is very individualized to see how your individual energy is, that decides the well-being of the individual. In a balanced state, the menses or the ovulation or everything will be inevitably balanced. So there's nothing you need to do to contribute to the balanced cycle. We are not doing anything in this body. We are just taking care of our mental, physical, and emotional balance. Along with it, eating the right food at the right time to nourish, to prepare ourselves for this cycle. This is very important. So listening to the inner voice is the core essence in this homeopathic philosophy for any health, and especially when we come into this PCOD, we have to take care of this cycle of this 28 days of periods, and the first 7 days or the next 7 days or the following after the ovulation. So this pattern has to be taken care by taking care of right foods at the right time, and also not only eating at the right time, because as a certified health coach, I do see people telling that, Anusha, I am eating healthy, I eat all the things that are good for me, but is the Agni in the body or the fire in the digestive system able to digest the food That is another key. So the nourishing and absorption into the blood for us to gain the energy is also needed for the cycle to continue in a right rhythm. So with a short note of a holistic, individualized perspective, I would like to hand over to the next person.
Okay, I'll invite Dr. Pooja from Bangalore to discuss her aspects of diagnosing, managing polycystic ovarian syndrome.
Namaste to all the elders and doctors gathered here. I would like to start a different approach through our Ayurveda, how the PCOS have been diagnosed and how the symptomatology will be assessed and the treatment approach. Basically, to get an idea, in Ayurveda, we have a basic principle called dosha dhatu mala moolam hi shariram. This sharira, which is made up of dosha. Dosha means bodily humus. Dhatu, the subtle tissues, which is again the supportive factor for the body. And mala. Of course, we think that mala is not required for the body. No, not necessarily. That understanding should not be, we should not take, because that is also a supportive factor for a healthy body. Now, with respect to dosha, we have two concepts. One, sharirika dosha. Second, manasika dosha. Why I would like to bring both these concepts here? Because in the context of PCOS, we have to think at the physical level as well as at the psychological level. So derangement in the physical level, that is in the sharirika dosha, vata vitiation, pitta dosha vitiation and kapha dosha vitiation. This we have to consider. At the psychological level, we have three manodoshas, sattvika, rajasika and tamasika. Of course, in derangement in the rajasika and tamoguna will end up with the disease manifestation. Now, with respect to the PCOS understanding, in Ayurveda, we follow the ancient literature, that is Charaka Samhita, which is considered to be a godfather for our Ayurveda, has exclusively dedicated a chapter related to the female genital tract disorders, that is Yoni Vapad, which describes both the physical abnormalities as well as the physiological abnormalities. So in that, PCOS, of course, in Ayurveda will not get such type of name. The diagnosis of a disease is based on lakshana, that is symptom. And this symptom will be assessed based on the derangement of these doshas, vata, pitta, kapha. Now, specifically, this particular PCOS is manifested if there is a derangement in the kapha dosha. In Ayurveda, we tell if a disease has to be manifested, there should be a vruddhi of a dosha or kshaya of a dosha. Vruddhi refers to the quantitative change. Kshaya in terms of qualitative change. If there is quantitative change and as well as a qualitative change, any of these, then which will end up with the particular disease. Particularly, in PCOS patients, predominantly we'll see the derangement of kapha dosha. Either it may be vruddhi or it may be kshaya. That's why the symptoms presentation will be entirely different. In some, they may manifest with the menstrual irregularities. In some, they may present with the facial hair presentation. That time, we need to analyze the taratama bhava of the dosha which have been involved in the presentation of PCOS. So, to conclude related to dosha, the PCOS disease is predominantly manifested because of the derangement of kapha dosha, which is considered to be the important precursor. Hence, our line of treatment will also go on the same lines. Now, It doesn't mean that only the kapha dosha has been involved. Any disease, if it has to be manifested, means vata and pitta will involvement is also seen. But of course, as I have told now, amshamsha kalpana, that is the tarathama bhava involvement, which dosha have been predominantly involved, that has to be assessed. This is one part. Now the second part is related to dhatu. As madam previously, naturopathy madam was also telling, as we take the food, that food will undergo different paka, and it will be divided into two, Sara Bhaga and Kitta Bhaga. Sara Bhaga is nothing but the Sapta Dhatus and Ojas, which is considered to be the most important factor for the sustaining of the longevity. And Kitta Bhaga, that is nothing but the Mala. Mala includes Mutra, Purisha, Sweda, majorly three, that is urine, feces, sweat. Along with that, we have certain malas also, which will be excreted through the nose, that is called Nasa Mala, through the Akshi, that is eyes, Akshi Mala, Karna Mala, etc. Now, with respect to PCOS, there is an involvement of Dhatu Dushti also. Among these 7 Dhatus, we consider the Rasa Dushti, the first Dhatu, Rasa Dhatu, we talk in terms of the plasma level, and Rakta Dhatu. These two are the main precursor in the manifestation of PCOS. So again, in the line of treatment also, we need to consider not only the dosha, that is kapha, even we have to think about the dushya, that is dhatu. If it is vitiated, then it is called dushya. If it is healthier, then it is called dhatu. Dharanat dhatavaha. That is, if it is in a good condition, which does the dharana, that is supporting system for the body, then it is called dhatu. If the same dhatu, if it is deranged, then we'll consider it as dushya. Rasa and rakta in a good quality, then it is a good dhatu. If it is a derangement, then in the pathogenesis, we'll call it as dushyas, rasa and rakta. Those two also has to be considered. Next, of course, the third one is mala. In the mala, of course, again, the mutra also involvement has to be considered. Because when we talk about anatomical entity, Ayurveda believes in the concept of srotases. For the general understanding, we consider it as a minute channels. Anything, the food or whatever we will take, that has to be circulated to all over the body through these channels. And especially in the context of PCOS, we'll consider as a one particular srotas, that is called as Artava Vaha srotas. In Ayurveda, we consider the reproductive part of a female as Artava. And in case of male, we'll consider it as a Shukra. Artava is having a broader sense of male, meaning it doesn't mean that only the ovum or ovary, it is a broader meaning. According to the context, we'll be changing that particular word. So any derangement in the anatomical aspect, that is Artava Vaha Srotas, that also has to be considered. There, the Mala plays an important role. So in total, to conclude, the understanding of PCOS in terms of Ayurveda, we cannot give a particular name. Okay, this disease, because so many disease explanation is available in Ayurveda, like Shandini Yoni Vapat. If there is an infertility, then we'll diagnose it as Shandini Yoni Vapat. If there is a prolapse, then of course we'll name it differently. But PCOS, we cannot give a direct diagnosis. Instead, we'll diagnose in terms of the involvement of dosha, that is predominantly kapha, then of course the dhatu, especially the rasa and the rakta, and of course in the context of mala, mutra also has to be considered, and in terms of srotas, artava. So some Ayurveda physicians will consider PCOS as Artava Vaha Sroto Dushti. That is a diagnosis name in terms of Ayurveda. Some physician may diagnose it as simply Artava Dushti, because we consider Artava as ovary, Artava Dushti. Some, the old practitioner, old school of thought, they'll consider it as a rasa dushti itself, because that dhatu itself is considered to be a main precursor. Some consider, because in the pathogenesis we have one more concept called as a avarana referring to the accumulation in one particular area, and there is a blockage, so the something function has to happen that will not be happening. So that is called as avarana, and this avarana takes place because of the main dosha involvement kapha. So that's why few may diagnose it as in terms of kapha avarana janya artava dushti. Of course, the line of treatment will vary depending upon the involvement of dosha, dushya, and mala. So I think with this a general understanding I have given with respect to the Ayurvedic perspective. The treatment point of view, I think we'll take up later.
Yeah. Thank you, Dr. Pooja. So let me say how we approach as an allopathic doctor this polycystic ovarian syndrome or polycystic ovarian disease. So when you look at the incidence and prevalence of this condition, more than 1 million women all over the world is suffering with these issues. And when you look at the cost of it, so it's more than $4 billion just only in US, they spend about $4 billion to manage this problem. So when you look at the etiology of this problem, it's very complex, and mainly we say it's an unknown etiology. Sometimes we can say it's genetic or environmental or dietary, or sometimes even they are blaming some inflammation, or there is no known etiology for this condition. But when you look at how it affects mainly 3 systems in our body, like reproductive, hormonal imbalance, and medically, like dyslipidemia, and even sometimes cardiovascular problems, and including endometrial cancer. So when you look at closely what happens, how does this all gets disturbed? So when medically, there is a disturbance with the hypothalamus, pituitary, ovarian axis. So there is an increased levels of luteinizing hormone and GnRH, just gonadotrophin releasing hormone. So this in turn affects the ovaries to stimulate the Pcos cells to make more testosterone and androgen. So that makes the condition like hirsutism, acne, and hyperandrogenic status. And then in the ovaries, the follicles become immature. They stop ovulating. That's why they create the polycystic immature follicles in the ovary that we always look at in the ultrasound that gives the diagnosis. The other thing which happens is insulin resistance. So when the insulin resistance happens, there is a risk for type 2 diabetes, and the patients, that's when it's the root cause for the obesity, patients start gaining weight, and we call sometimes as a metabolic syndrome too. Then the third thing, it happens, anovulatory cycles and increased weight gain, disturbing the metabolism, making hyperlipidemia, then skin conditions like with acne and hirsutism, and emotionally, these patients are always almost depressed and has an anxiety issue. So the percentage of women who have the age group can be from teenage up to 44 is almost 20% of the population in the world is going through this problem. As an OBGYN, as a teenagers, they come in, they miss their menstrual cycle or irregular cycle, increasing weight gain, and they come very shy with facial hair or acne, and the moms usually bring the children. So how do we approach this issue? And so the reproductive age group women will come with the history of miscarriage, or they are trying to get pregnant for many years, it doesn't happen, or like some women like bleeding for like 21 days, 30 days, and with the clots and anemic, to sometimes even their hemoglobin will be so low as even 5 or 6 grams, to the point they need blood transfusion. And some women in their 40s, they come with the same issue for a long time, like underdiagnosed or not treated. This endometrial biopsies can show hyperplasia, or including 1 or 2 patients get endometrial cancer. This is how the presentation. So how do we approach it? As a teenager, so you diagnose, mostly it's a clinical diagnosis, then you do some lab test, finding out their, the high cholesterol level, increased hemoglobin A1C, or the sugar levels, or their hormones increased, free and total testosterone. And then you manage, like after diagnosing, mostly clinically and supported sometimes by the lab test and pelvic ultrasound showing bilateral ovary with follicles. The biggest challenge the allopathic doctors face is the time, So basically we give to regulate the menstrual cycle. So you educate the patient. Sometimes you treat the anemia associated with that, start the birth control pills to regulate their cycle. And then you kind of watch them like, every 3 months. The diet and exercise is the primary modalities of treatment. Like we tell them, okay, you have to lose 20 pounds like a prescription, and like you start low carb diet and high protein diet, and we follow them every 3 months. So I will say the compliance of these patients in losing weight, in changing their diet, it's only 50%. So because there is so much personal involvement is needed by the patient to do this losing weight and changing their lifestyle and diet habits. But do they respond to birth control pills, and do they respond supplementing iron? And sometimes we also discover like hypothyroidism when they have PCOD, and then we correct the anemia, we correct the the ovulation cycles by giving them the birth control pill. And 50% of patients, just by doing this medication and adding this the vitamins, and they feel better, and just by symptomatic, and they kind of get their periods regular. We correct the anemia, we change the insulin resistance by giving a low dose metformin. And women who wants to get pregnant, we add this ovulation inducing medicine like clomiphene citrate, like that. Yes, there is a 50 to 60% of success rate with all this treatment. And so how do we manage the other skin conditions like an acne or facial hirsutism? We add spironolactone. So it's anti-androgenic. It converts, it actually blocks the androgenic pathway in this problem. And then it kind of helps the acne and the excess hair. So what I feel like, when I started the practice, like this PCOD was like only like 1 or 2 patients in a week, or a few patients. The incidence and prevalence of this condition was very, very low. By now, with the new generation of technology and processed food and sedentary lifestyle, the prevalence is increasing. Like, I will say in a day, 5 to 6 polycystic ovarian syndrome. And it's kind of a frustrating problem because there is so much involvement from the patient side is needed to lose the weight and change the diet habits. That is the main role of actually the aspect of managing this problem. But medically, yes, we could able to do, make them reverse the biochemical changes, make them ovulate, get them pregnancy. Even during pregnancy, the PCOD has to be managed properly. There is a high risk of miscarriage, high risk of preterm deliveries, and then same patients can get preeclampsia, and so many issues. Even during pregnancy, we have to pay attention, continue their metformin, continue monitoring the baby, improving their nutrition, exercise, and to give a good outcome. As an allopathic doctor, I will say this is not totally like, can be managed just by medication, just by educating them, but it's a total involvement of the patient is needed to understand their own issue, why this happens, and to understand, like as other doctors were discussing, like listening to their inner voice, changing their lifestyle, changing their diet, and then it's no more a disease or no more a problem. It's just making the imbalance to be balanced. So that's why I invited like all of us to discuss this issue. Yes, there is a role in allopathy, like, some of them are like, quick fix, but it needs a long-term disciplined lifestyle and patient involvement in managing this.
They need they need constant inspiration and literally hand holding, irrespective of their age. So I'm doing like this, involving a dietitian who is helping them about the diet, and another is yoga therapist who will help them, sit with them at least for 3 months every day, slowly starting and helping them with yoga. I myself will sit, and we have Swamiji, our Supreme Pontiff of Hinduism, has shared with us Nitya Kriyas, the kriyas with various postures, pranayama, and how it helps to alter the energy flow to the affected organ, especially ovary, uterus, and the endocrine system, it's the whole endocrine axis. So with the Nitya Kriya for cure for obesity, I will share the link and also the basis of the Kriya, how it works at the end of the talk. It will help them to practice this Kriya continuously for 21 days without a break. If there is a break, again, they will do it. That will reduce the central obesity, the obesity in the waist, and significant alteration in the hormone disturbance we have been seeing. And also when we sit with them and they do, as Dr. Prema was sharing, due to the lack of time, when we just prescribe and do not handhold them to do the lifestyle modification in terms of diet and exercise, whether it is yoga or kriya or whatever is suitable for them, they will very soon lose inspiration and they again fall back to the same kind of lifestyle. So when they are supported, so I as I said, integrated approach is helping most of the patients who come here. We are helping them, spending time weekly, 2-3 sessions for kriya. If it is dietary session, asking them to come after 3 weeks, sit, find out what change they have brought on and how they are finding with the new dietary approach. When we are able to do this continuous follow-up, there is a significant change. They are able to lose weight. They are able to get back ovulation, regularity of the menstrual cycle. They feel confident about themselves. The depression was what Ma Prema said, is very truly seen in all these, especially young women and young girls. They do get confident and they get inspired and they adopt this new lifestyle, and they are able to get back the menstrual cycles regularly, and the ovulation is happening in many of them. Many PCOS people have conceived also. So I thought I'll share this clinical experience with all of us today.
Thank you so much, Dr. Shanti. That's true. Like, the patient involvement and after being with Swamiji, when I meant like it's more consciousness, more intuitive, like when we really we go along with them, call them, remind them, more frequent visits. And also now I started referring my patients to naturopathy and Ayurveda doctors to learn more deeply. Like, it's so impressive that how the way they explain about this polycystic ovarian syndrome, it's really fascinating, and it gives so much hope to the patients. It's not a disease, actually. It's not a syndrome. It's just an imbalance. They need to correct their lifestyle and the diet. And yeah, thank you. And Dr. Nivita, like, you can share some, how you manage, and also like all of us, like just a little few lines, like how do we manage it, like without this prescription and medication. So like Dr. Anusha, Nivita, and Dr. Pooja, and we both too, like this is not a chronic illness. This is not a chronic disease. This is a result of like our lifestyle. Like, we are not, as Dr. Nivedita said, we are moving away from nature. We are moving away from a lot of good stuff in our life. especially the younger generation. They don't even know, what is good food. With all this too many fast food, too easy to get it, and there is so much of spoiling this health happens from young age. So how do we structure some of the recommendations as young kids, what they can do? We don't see any kids in the playground anymore. They all sit in the fast food restaurants with their cell phone and the music, and the culture is changing. But as the culture changes, we are getting more and more new problems health related too. So Dr. Nivita, how do we manage this in a simple ways with the different age group? You can say here, and also you can post in a very structured managing, the patients can read and do for themselves.
Sure. Actually, I look this as actually nowadays all the female child, they are promoting or encouraging to be like a male. Actually, the dressing and the activity, the household activities, they are not encouraged. The cooking or caring of a baby or putting a column or all these soft hand works, I can say it's a right brain activating. That is a left hand activities. Previously, when we churn, we used to do with the left hand, the chakki, and we will use with the right hand. And also ammi, we used to do it with the both the hands. And churning of the buttermilk, we used to do it with the both the hands. And sweeping or vessel washing and everything. So this thing and all, it is a balancing both right and left hand. But nowadays, we are giving more importance for the right hand activity. So our left side brain is more activated. So there is an imbalance. So there is a lot of internal, that is emotional level also, they are disturbed a lot. Mentally, they are more tensed, stressed. They are unable to enjoy what they are doing. Example, if they do column, after the beautiful column, they will enjoy. So during that time, the hormones, we can say it is a happy hormones. So when we feed anything, like example, when we feed to crows, or when we feed to a cat or a dog or a cow, or when we feed to our fellow people, that is a household people, when we cook. So that time, when we feel so happy within ourselves, so that time, then there is a more production of happy hormones, endorphin, dopamine, and all these serotonin, all these things. But instead, nowadays, all the girls, they want to achieve something. First rank, you have to achieve first gold medal, or you have to get a job, or you have to get a more money, or the family burden. One people cannot manage the family financial problem. So both you have to work. So we are promoting all the girls to become a more stressful, more strained, and they are very anxious. So their lifestyle become more speed. So because of that, the speedy thinking process, the body is unable to cooperate. There's a conflict between mind and physical body. So our body is made up of so many nadis, 72,000 nadis are there. When we stressed, these nadis are blocked. Because of this blockage, the energy flow, that is ojas or prana flow to the particular organ is disturbed, blocked. So for this, we are suggesting them to go for, first one is the counseling. So first you have to feel, being a female, being a woman is a very good boon. It is a adding, it is a boon for us. Actually, it is a beauty for our life. So instead of that, many girls nowadays, when I was consulting, that time they're telling, I am unable to do like a male. I am unable to go for short dresses, or my family are restricting. So I'm not feel to be like a female. So that it is a conflict that creates, there is autoimmune disorders. That is the internal endocrine system is disturbing. They are all the system inside is disturbing. So first we are making them, we have to tell them, being a woman and a child, that is a motherhood is a wonderful thing. It is a, we have to enjoy. It is more enjoyable rather than being a other stressed work and getting money and financial management, the child rearing and caring of the family people, and enjoying the household work. Nowadays, it is very least bother. And so we have to emphasize them so that the left hand activity will be improved. So the neuromuscular axis will be developed. So the right side brain, which takes care all the ovulation and other things. This will be maintained. So this is one thing. Another thing is the right food. Nowadays, due to the more gadgets and excessive heat, we are not following any oil bath, or we are not sleeping in a rhythm of the day. That is, many girls, they are waking up to night 3 o'clock, 2 o'clock, and sleeping in the daytime. So because of that, the internal rhythm, the nadi balance, the cycle of the nadi is disturbed. So this thing we have to tell them how you can correct your lifestyle in accordance with the nature. What time you have to get up, what time you have to eat, what time you have to work, what time you have to play, and what time you have to go for sleep, and self-analysis. So self-positive energy vibrations, how you can improve it. That is I can say self-rewarding, and how you can do yourself. Nowadays, the girls, they are expecting someone to praise them. Instead, then how you can make yourself happy. So when they are happy, automatically the homeostasis of the physical body will be regained. So this psychological balance, and nutrition wise also, I used to suggest to go for more seedful vegetable and fruits. Nowadays, they are taking more seedless items. So what we eat, that we are. When we eat more seedless, we become seedless. The anovulation happens. So I used to suggest to go with more pomegranate and guava and custard apple and sprouts and chia seeds, flax seeds, all the life-rich food items. They can at least 30% of the diet, it can include these things. And another thing is, they have to connect with the ecosystem, nature, sun and soil. They have to connect with the sunlight and also the soil. Previously, we used to cook with the mud pot, live in the mud houses. So there is so much bioenergy was there. The magnetism was so good. But nowadays, we are missing all those things. So I am encouraging these things, connecting with the soil. So feel the grounding and how the mud is connecting with you, and air, sunlight, and a good pH increase. That is a alkaline water. When you put it in the mud pot, the acidic mud, the water can turn into alkaline water, or rainwater drinking, or adding some herbs. So all these 5 element connection, and psychological counseling, and right dietary habits, and yogic practices. This yogic practices will remove the blocked nadis. So automatically the energy flow will go. And in naturopathy, we used to give so much meridian massages and mud bath, the whole mud application. And for weight loss, we used to go with all sweating therapies, plantain leaf sun bath, and water jacuzzi, hot spring baths, and dietary changes, fasting therapy, to make the autophagy of the cyst, which automatically it will give rise to proper cycle. So this way I used to treat PCOS. We have a wonderful result, and automatically in natural therapies we used to give many nutrient baths, aloe vera bath, and papaya bath, banana bath. So these all body wraps, it automatically improves the skin tone and removes the acne, and this gives a wonderful feel for them. So psychologically and physically and energy level, we have to work. It is working very good. Thank you.
Yeah, thank you, Dr. Nimita. It's really good. And, it's wonderful. I know the results will be almost 100% with all this. You are involving the patient, and they do learn and treat, and I think they can practice their lifetime and get out of this. And it's really simple and easy. And, I think it's wonderful. Thank you. And Dr. Anusha, that how do you manage just like, few lines of managing and simple that we can put it in our Facebook?
Yes, as I mentioned earlier, listening to the inner voice is the first key for health and success. So when I take the case, I'm able to see the deviation in the children or the parents, or as an individual, the condition where there is. So addressing it with homeopathic remedy does help to bring back the balance in the person. Definitely possible when we are able to find the right remedy. So that is at one level. The other level is not just stopping there. We have to create awareness, educating them about health. It's very high time that we are in a stage where people are just not aware. We are just caught by labels and names. If you just say they have this ADHD problem, PCOD, they just feel very low and they just feel inferior, and it's like a lifetime management and they don't have any other option. So that's how the society is at this point of time. So when I say that leave alone, put it aside of all the names and everything. So what you are feeling, where is the problem according to you? So you can really see that, there may be a not paying attention to the diet. That may be a reason. So they may not eat healthy for nourishing the body, especially when women are going through this phase. The right foods to have this ovulation or this menstruation is so vital. So right food is important. And another point is there is an imbalance in the society of peer pressure. It's like, as Nivedita was sharing, it's like a woman struggling to be a masculine nature from the very young age, in the societal level, in the school level, in the friends level, and things like that are there. So on educating the child and also the mother, just accept the child as she is, to give enough love and have a lot of fun with the child from the young age with right interaction helps to blossom the child. That is the first nourishment according to me. That's how I say, if the child is coming at the very puberty level. Because when they have a weekend interaction of fun and gathering, or even a fun in eating, cooking, or any type of variety, creativity in their action and interaction, not just looking at the grades and numbers and things like that. So that really enhances their energy, and they feel motivated. They feel they are really worth. The self-worth increases for them. They feel more joyful. At the end of the day, the whole existence, the whole creation is a beautiful piece. And the only purpose for us to just enjoy our life in this world as long as we exist. This is the ultimate purpose for any existence. So just enjoy every moment, have that fun, and also learn. As a certified health coach, I try to educate them of right eating, timely eating, and what are the right food, and also what is the genetically modified foods, for what happens when you eat processed food. So like that, like you need to educate them, and they look upon you to learn this. They want this type of knowledge and they are happy to receive. So just by listening, they feel, wow, I feel so good. And they write to me, the kids or the parents write to me, I have changed my whole system of eating. I had a child, she was so, she used to study well and she used to get 80, 85, but the mother feel at the moment, oh, you just got only B, oh, you're not getting A, something like that, she used to say. And after the session or something, I just simply said that, what is there in A and B? Just to be happy. Automatically, she will get into A, not just by just talking and making her do this. So just by little bit of educating the parents. And after that, the next session I had, the mother and father both attended the session and told me that I have changed my outlook with my child. They stopped. They had a lot of fun activities. They had a lot of sessions with not only fun as an outdoor, but having a fun of even cooking, and also talking about talking about learning to eat this fruit, that fruit, and then they have that activity that day and make that dish and then eat. So that immediately within a first one sitting, the second session, I could see a huge change in the parents' outlook. And even the child felt very motivated, very relaxed, first being at self, relaxed to talk, and felt energetic. Just by creating awareness, there is a huge shift happens and lifetime corrections. So the day starts with in the present society with the gadget. Like yesterday I had a client, she said that, oh, okay, I have eye problem, but I need to look at my phone for the morning email. I said, what happens if you don't see the phone for half an hour? What's going to happen? So go out and do some skipping or some gardening and some, planting some plants and so spend some time. And it really motivated her. Oh, I love doing all these things. I said, definitely you can do it. It's not that you need to spend your age at the teenage just by gaining knowledge and getting certificates, nothing like that. So like that, correcting, educating the lifestyles, the food, and the emotional balance. Definitely, yoga is wonderful, and we are blessed, born as a Hindu, to have this knowledge. And yoga balances the prana, balances the emotional level. So these are some of the takeaways which even without remedies, without treating, there is some change immediately happens in their moods, in their food, and automatically it shows even in their cycle and everything. So as a general overall holistic perspective, I spend a lot of time in educating. Plus, I take the case symptom by symptom at physical level, mental level, emotional level, and what are the challenges they face. I take as a whole case, not as just a menstrual problem. I take as a person. He's an individual. So I take everything, and the remedy is based on the whole totality of physical, mental, emotional, everything is taken, and the remedy points to those total symptoms. So one is homeopathy helps in rebalancing. One is educating and educating and educating. And I have definitely seen success by talking, and they really love to come back, and they are very open. So they need somebody to open. That is another challenge, is the suppressed menses, the suppressed canti are all people where they feel that they are not able to share their struggles in society, and they don't have a door. Here, I'm just an open platform. You tell whatever you want to say, and everything is confidential. The moment that I say that, they just really open up. There are moments where I don't share even to their parents or something. It's just that itself loosens their muscles and makes them a wholesome person. Being a wholesome person is the key of health.
Yeah, thank you, Dr. Anusha. I know you are doing such a wonderful service, and I learned so much today that it's, of course, like it's true that, it starts at the individual level, family level, and simple things, doing things together, and it gives so much of teamwork and loving and openness and accepting, and everything starts just loving yourself. When you love yourself, you heal yourself too. And I do invite Pooja to say, how do you manage this? Are there any herbs or something a special diet in Ayurveda that helps them to balance their nutrition, emotional well-being, and what's your way of treating these patients?
Again, Ayurveda follows three treatment principles. The first one is samshodhana, that is biopurificatory. Whatever the deranged dosha, dhatu, malas are there, that will be expelled out of the body. Automatically, the equilibrium of the doshas will be maintained. So this is the first line of treatment, samshodhana. Second line of treatment is samshamana. Samshamana means here we are not going to expel out the vitiated dosha. Instead, we'll be giving certain medications through the oral route, which will combat the symptoms. So that's why we'll consider Samshamana Chikitsa as Vyadi Pratyanika Chikitsa. In Sanskrita, the disease is called as Vyadi. Hence, Samshamana treatment is concentrating towards the symptom, whereas Samshodhana is concentrating towards Dosha Pratyanika Chikitsa, as we have discussed already in the basic concepts, that how we are going to understand the pathogenesis. There is a derangement in the dosha, dhatu, mala. So we have to make it equilibrium, means we have to go with the Samshodhana. Second is Samshamana. And third and most important is Nidhanasya Parivarjanam. Nidhana refers to the etiological factors which are responsible for the manifestation of this disease. In Nidhana Parivarjana, we have Ahara, Vihara, Achara and Vichara, which includes everything, the diet, the regimen, and the yoga practices, pranayama, the spiritual process, everything. Next, with respect to Samshodhana, in brief, I'll go. With respect to Samshodhana, we have mainly 5 purificatory therapies, but we cannot advise all the 5 in PCOS. Mainly, we'll go with 2 treatments, that is Vamana Karma and Virechana Karma. Vamana Karma is called as therapeutic emesis. We'll go step by step by administering the oral medications plus medicated ghee, and on one particular day, we'll induce the vomiting using certain herbal medications. So those herbs will enable us to bring the vitiated doshas only, not the healthy doshas, only out of the body, through upper route, through the oral route. And that is nothing but just like a vomiting process. It is not a vomiting, it is a therapeutic emesis, and this is called as Vamana Karma. I think you can browse in Google. There are encouraging results we will be getting in the management of PCOS. Many research works also have been carried out at the post-graduation and PhD level. Many patients will turn to us by they'll be fed up with taking oral hypoglycemics, as it is considered to be the drug of choice in the management of PCOS. They'll come to us and will advise this particular treatment, that is Vamana, and immediately that their irregular menstrual cycle will be regularized. This is the first thing. Second, we have one more Samshodhana line of treatment, that is called as Virechana Karma. It is called as therapeutic purgation. Here, we'll give the medications and those deranged doshas will be expelled through the rectal route. In Vamana, it is through the oral route. In Virechana, it is through the rectal route. That means only the vitiated doshas. So with this particular Samshodhana treatment, we could see many changes at the level of endocrine, at the level of neuron level. So many things we will see, that is having a broader understanding, and we are sure, and we have many research papers also, and we have got very encouraging results in the management of PCOS by using this Vamana Karma and Virechana Karma. This is a part respect to Samshodhana. Next, I'll come to Samshamana. In all the patients, it may not be possible to go with Vamana and Virechana because the Sattva also plays a very important role. When there is a derangement in the hormone, many a times the person's Sattva will be very low. I think everybody can know the Sattva. Many can tolerate, many cannot tolerate. We generally believe that the Pravara Sattva is an essential key to conduct the Samshodhana. Unless there is no good Sattva, we cannot go with that particular Samshodhana treatment. In such case, we'll go with this palliative care, that is Samshamana Chikitsa. We are concentrating on the Lakshana. If there is a irregularity in the menstrual cycle, then our drug of choice will be entirely different. If there is a facial hair growth, then our drug of choice will be entirely different. To quote one, if there is a derangement in the menstrual cycle or irregularity, we'll be routinely prescribing, we'll be taking one particular drug. In Sanskrita, it is called as Varuna, and in botanical name, it is identified as Cretiva nervula. In the market, we'll get its preparation called as Varunadi Kashayam, which is the combination of many herbs that will be given orally. This is one very common prescription. Second, of course, we have a very good drug that is called Haritaki, and in Ayurveda we believe that Haritaki considered as Patyanam, which is a very good drug of choice, botanically termed as Terminalia chebula, that also will be given orally. Along with that, we have many rejuvenating drugs like Guduchi, Tinosporia caldifolia. We have Shunti, gingiber officinale. All these drugs will be administered depending upon the presentation of symptoms. This particular selection of the drug. Few practitioners will administer the single drug, that we call it as Ekamulika Prayoga. Many practitioners like we will give a compound preparations like Varunadi Kashayam, Chitrakadi Gulikam, Guduchyadi Kashayam, Haritaki Churna or Haritakyadi Churnam. Like these combinations will be given for a certain period. When in comparison with Samshodhana, the encouraging results are lesser in Samshamana. As we know, in Ayurveda, we believe that, very clearly quoted, Doshaha kadachit kumpyanti jita langana pachanaihi jita samshodhanairva natu tesham punarudbhavaha. If a person or a disease treated with a biopurificatory therapy, then natu tesham punarudbhavaha. In that particular person, the recurrence of the disease will not be seen at all, provided this treatment has to be carried out in a proper manner by the expertised physician under the supervision, and at the same time, patient also should follow certain very strict diet and regimen during this particular protocol. Now, last is, of course, the Nidhana Parivarjana, which includes Ahara, Vihara, Achara and Vichara. Ahara, as rightly pointed out in the Samhita, as there is an involvement of Kapha dosha, hence you need to advise a patient that the diet should combat the Kapha dosha, which should not increase the Kapha dosha. Many a times we'll ask the patient not to take curd. Buttermilk can be taken, but curd is considered to be the worst food in case of PCOS. Of course, we too advise not to take the potato, brinjal, such type of drugs, vegetables should be avoided. In terms of Vihara, again, which includes many other things, in that we specifically concentrate on the certain yogic practices and pranayama. Of course, achara, vichara, these are all the psychological factors that we have to control our own mind, so that at psychological level, if we balance the doshas, even in Ayurveda also, we tells that prasanna atma indriya manaha, then only the person is called as swastha. Not only the homogeneous dosha dhatu, prasanna atma mana is also very important. So in total, PCOS will be managed with the 3 steps. Samshodhana, in that mainly 2, Vamana karma and Virechana karma. Samshamana, depending upon the symptom, will choose the drug. And lastly, the Nidhana Parivarjana. So we too got lot many encouraging results. Many research papers are available even in Google, PubMed journals. So can browse and make use of that. So this is about regarding the management with special reference to Ayurveda related to PCOS.
Yeah, thank you, Dr. Pooja. Really, I appreciate your depth of wisdom in what you're doing. And it's really, really useful to know, like, you know, Swamiji gave us like the Haritaki like 15 years ago, said like it's a mother of herb. And now we know, like, you know, see what you and Dr. Anusha and Dr. Nivita shared, and me and Dr. Shanti is already doing all these combined treatments to her patients. And it's kind of opened our eyes and all. So if anyone wants to say something, and it's good, and I really thanks from my heartfelt gratitude to all the doctors and friends, and let's start this and do this as our passion. Thank you.
While sleeping, the girls or the PCOS people, they can put eye pack. It is a small cloth. They can fold it and they can keep it on the eyes. So it will create a good darkness and also coolness to the body. So this helps for the regulation of the hormones. It can be done during sleep. Before to sleep, they can put it for 10-15 minutes, or they can leave. So this will help a lot. Thank you.
It's such a good thing. Thank you.
So it's so amazing to hear from all the practitioners. Like the saying goes, if we're trying to fix something and the only tool that you have is a hammer, everything that you want to try and fix becomes a nail, right? But what I heard from every one of you, now we have literally a toolbox of various approaches to not only address the immediate symptoms of PCOS as well, but also go beyond that and completely cure that condition that seems to affect women everywhere, and make sure that it doesn't recur again. So it's an amazing sharing. So we'll be doing more often, and we'll see you all next time.
Thanks for your time, all of you. Thank you. Thanks.
Thank you for the initiative taken and Namada Purnamaya Purnameva Vashishyate. Shanti Shanti Shanti.
Bhagavan Sri Nityananda Paramashivam Adhivarpanamastu. Om Nityanandam.
Thank you.
Thank you. Thanks, everyone.
Thank you.
Thank you. Thank you, Pooja.